More watching Fox 29. This is Good Day Philadelphia.
Plus, should Adderall be pulled off the shelves? We'll debate the present-day Ritalin with two of the area's most respected minds. Yet Dr. Mike and Tom Klein here this morning on Good Day.
It's been called the Ritalin of the year 2000. Adderall is a drug used on children who have attention deficit disorder, ADD. Now Health Canada has taken it off the market there, while the FDA has simply suggested a labeling change. Is this something too dangerous to give your child? Patient rights attorney Tom Klein is back. Good morning, Tom.
Good morning, Jen. How are you?
I'm well. So is Dr. Mike Srigliano, a Penn internist and Fox 29 contributor. Good morning, Mike.
Good morning, Jennifer. Good morning, Tom. How are you guys?
Good morning, Mike. We'll solve another problem this morning.
Tom, we're going to begin with you. You question the FDA's decision. Why is that?
Well, Health Canada clearly reached a different point of view, Jen. They're working with some different standards, but Health Canada has the right to take a drug off the market, suspend it immediately. Here you have 20 unexplained deaths, heart attacks, cardiovascular events, along with something like 12 strokes. Health Canada said this is a real problem. We want to err on the side of safety, and a black box warning, a warning that the drug is safe for this kind of thing, just won't do the trick. So Health Canada takes the drug off the market. The FDA puts a label on it and says, well, you know, be careful. And therein lies the controversy.
Mike, what do you think about that? You think it's enough?
Well, over 700,000 people take some form of Adderall every day in the United States. And yes, this is tragic. In reviewing the literature on Adderall, in Canada, there are 20 cases of what they call sudden unexplained death. In the United States, since 1999 to 2003, there were 12 cases. Now, you know, 700,000 people take this drug. Many of them gain and derive benefits from it. There are going to be patients that have problems with any drug. And so I think that the FDA is warranted in making us as healthcare providers very aware that these drugs have the potential to cause harm. But you have to remember, almost 50% of those patients in this country that died had some underlying cardiac disease. And it gets back to having a relationship with your doctor so that you know whether or not this is a good drug to take or not.
Well, here's the problem as Health Canada sees it. You have sudden unexplained cardiac deaths. You can't warn about that problem. You would have to do an EKG, or you'd have to do some very careful monitoring to find these structural heart defects. And the problem that we have, and that Health Canada so aptly pointed out, is you have a drug that's prescribed, I think, 23 million prescriptions written a year, 1 million kids on Adderall. These drugs are stimulants, and if you have a heart problem, unbeknownst to a parent, and by the way, I think Mike would agree, there's lots of these kind of cases, you could have a sudden cardiac incident. And I think the problem, and I think Mike puts his hands on it, is you can't begin to take this kind of drug, or more importantly, you can't put the drug into your child, a drug, by the way, that has not been tested in children under 6, at least as I understand it, unless you carefully evaluate these issues with a physician. It's not like taking candy.
Mike?
I totally agree, Tom. Which is kind of wild that we agree. The fact is that everything that we take, every drug, whether it's an aspirin, has the potential for harm. So if you have a child that you think has attention deficit disorder, 1, you must get a proper diagnosis. 2, you need a doctor that will look into whether they have any cardiac problems or not, or even a family history of cardiac problems like arrhythmias or funny heart rate problems. And before you give that child that medication, you make sure, to the best of your ability, that the benefit outweighs the risk. And that goes with every drug. We've talked, Jen, for months about all kinds of drugs. The bottom line is you don't take anything unless the benefit outweighs the risk. It's like getting on the Schuylkill. If you really want to get somewhere and you're willing to take the risk of getting hit by a truck, then it's worth it.
But the question really becomes, Mike, in the judgment of the equivalent of the FDA in Canada, the government to the north of us, which is oftentimes right, as we know, on many issues, they're saying that this drug should not be on the market, at least until the drug is more thoroughly tested. And that raises, it would seem to me, if I were a prescribing physician, that raises a real red flag in terms of how I'm going to want to approach it.
Tom, I'm going to get in there. Tom Klein, I really appreciate you coming in this morning. Dr. Mike as well. Seems like there's much more to talk about this, and we will do that when time warrants. Thank you both, gentlemen.
Nice to see you, Jen.
You as well, guys.
Take care, Jen.
Okay.
Now to health news tonight and a surprise decision by an FDA advisory panel, which is urging the federal government to put the most serious warning there is, what's called a black box warning, on an entire class of drugs used by millions to treat attention deficit and hyperactivity disorder. The FDA doesn't have to go along with this panel, but it said today there are concerns the drugs can lead to sudden death in people with heart problems. Here with the story, NBC's Tom Costello.
They are household names, Ritalin and Adderall. 4 million people, including 2.5 million children, now take the medication to treat attention deficit hyperactivity disorder, stimulants that increase the blood pressure and heart rate, and some doctors believe could be deadly for small numbers of patients.
And not to make, at the very least, a very strong warning to people that there is uncertainty here about the safety of these drugs, and that they need to be aware of that, pending clarification, I just think is inappropriate, unethical behavior.
Today, an FDA advisory panel voted to recommend the strongest possible warning, that in some patients, the stimulants could lead to strokes, irregular heartbeats, and sudden death. The FDA has yet to do its own investigation, but early reports suggest ADHD drugs may be linked to 25 deaths, including 19 children. A small number, but doctors believe many cases go unreported and worry that children with undiagnosed heart conditions could be vulnerable. 12-year-old Stephanie Hall died of heart failure after taking Ritalin for 5 years.
There's no way I would subject my daughter to that because I think her life is more important than her grades.
Recently, there has been controversy over the safety of stimulant medications used to treat attention deficit hyperactivity disorder. As you probably know, ADHD is a common debilitating disorder characterized by inattention, hyperactivity, and impulsivity. It affects 3 to 5% of children in the United States. Untreated ADHD has a poor prognosis. Almost half of ADHD students never finish high school. Stimulant drugs such as Adderall and Ritalin are commonly used methods of treatment. Numerous studies have shown these effective drugs to reduce the symptoms of ADHD considerably. The side effects of these medications include appetite loss, delayed sleep onset, and headaches. These are generally tolerable and mild, and do not affect the decision to use the medications. On the other hand, there has been heightened concern among parents, doctors, and government health agencies regarding the cardiovascular side effects. As stimulants, Adderall and Ritalin are well known to moderately increase blood pressure and heart rate during active treatment. The pharmaceutical companies which manufacture these stimulants contend that the increases in heart rate and blood pressure are clinically insignificant and should not affect how they are prescribed. The cardiovascular effects may be more serious than these companies let on. Also, the potential risks are becoming more important as the diagnosis of ADHD has increased, and stimulants are being prescribed for significantly longer periods of time. Add to this the increasing rates of hypertension, childhood obesity, and cardiovascular disease in the United States, and we have a serious concern on our hands. The FDA has recently added a warning to drug labeling stating that patients with known cardiac structural abnormalities or a family history of heart problems should not take these drugs. The FDA's decision to add these warnings was based on 25 cases of sudden cardiac death in children over a 5-year period in which stimulant treatment was strongly correlated to the deaths. The rate of incidence of sudden cardiac death was found to be roughly the same for the general population. However, the FDA's findings are flawed because they rely on incomplete data that was voluntarily submitted. The investigation reveals a lack of definitive research on the long-term cardiovascular risks. Also lacking is a complete registry of adverse events related to stimulant treatment. Until the risks are completely understood, certain precautions should be taken. Patients already undergoing treatment should receive routine cardiovascular monitoring by their doctors. Those considering stimulant treatment should have a thorough cardiovascular evaluation, including an EKG or heart scan, to make sure that there are no pre-existing heart conditions or cardiac abnormalities. For such widely prescribed drugs, The cardiovascular risks are quite unknown. This is unacceptable. Do your part. Write to your local representatives and demand thorough research by the FDA so that ADHD can be safely treated.